All right, what's up, everyone? So, welcome to our next episode of Wake Up with Walters. Today, we're going to be talking about the quest for a tighter tummy. So, we'll let everyone kind of get on, and then we'll start talking everything about tummy tucks and really go through kind of, the different types, because there's not really just one type of tummy tuck for everyone. Hello, hello. All right, we'll wait a few more minutes, get people on the live session, and then we'll start talking everything about tummy tucks. Okay, we'll wait a few more minutes. Again, if you guys have any questions and want me to cover some things at the end, just put that in the comments below. And we'll try to get through it. Yesterday, for some reason, Instagram didn't show me the questions, so I didn't see them. So if you have any questions, just put them in the comments, and we'll try to get through as much as we can at the end of my little talk. All right, could you discuss pregnancy after tummy tuck? Absolutely, great question. All right, so let's begin. So today we're going to talk about one of my blogs that I have on the website, and it's called The Quest for a Tighter Tummy. Which tummy tuck is best for me? And so, one thing that I kind of want to talk about, if you look at that picture that's above, let's kind of bring it up. So if you're able to look at this picture and look at this, model and look at her tummy, that's what we're trying to recreate when we do a tummy tuck. And so what we're trying to do is keep or recreate a natural stomach. And if you see, there's what we call, hills and valleys. So if you look at, above the belly button, there's some definition in the line, what's called the linea alba. So, right above the belly button, we're trying to recreate that definition. And then on, the sides of the abdomen, there's definition, and that's called the linea semilunaris. So those are things that, with, weight gain and weight loss, and, after having children, that, we tend to lose some of those normal definition and architecture of the stomach. And so the goal of a tummy tuck is not really just to tighten and flatten the stomach. It's to create, a normal defined stomach. And sometimes we can even, depending on what your goals are, really make it more athletically defined. And so if you see, there's different shadows. There's what we call hills and valleys on the stomach. The belly button is very natural in this photo. You can see even really the location of the belly button. So, if you look to where her iliac crest is, or really just her hip bones, you can see that the belly button is really somewhat in line with her hip bones. And so, there is some variability of where the belly button can be, but you want to make sure that it's really not too high, and you want to make sure that it's not too low. And so that's something that is a very important part of tummy tuck surgery, is making sure that the belly button is done in the most aesthetically pleasing manner. So, those are all kind of goals. Where definition, normal belly button, and flat tummy. And so that's kind of, really what we're trying to achieve. So there's obviously different types of tummy tucks. And so we'll talk first about the traditional tummy tuck. And, you can follow along a little bit in the writing, and as well, this is on my blogs, on my website as well. So this is really kind of the most easy tummy tuck to plan for. And what I mean by that is it's really someone who has a lot of excess skin, and we're going to go through all kinds of pictures at the end to kind of make all this come together at the end. But, really someone who has a lot of loose skin, has some leftover fat of what we call, lipodystrophy, has significant muscle separation. So, really with weight gain and weight loss, the muscle, the diastasis recti that we call it, that's the medical term, the muscle gets loose and gets separated. And even with pregnancy, that occurs as well. And so there's different degrees of that. And so, people who have significant diastasis or muscle separation, they have significant loose skin, and they have what we call lipodystrophy, then a traditional tummy tuck is what's needed. And what that means is that we basically take out the skin really from hip bone to hip bone, wherever that excess skin is. We take it out from the belly button down to the lower incision that we place. We tighten the muscle from really underneath the breastbone all the way down to the pubic bone. So a full muscle repair. We do liposuction as well. And then the goals are to keep a low incision, natural belly button, maintain abdominal character or abdominal definition, in a natural belly button. Now that usually traditional tummy tucks come with larger scars than most other types of tummy tucks, and usually that's really from hip bone to hip bone. But the goal is always the same, like in every tummy tuck, is to hide the scar, natural belly button, and to create as much definition that we can. Okay, so the other one that we talk about is mini tummy tuck. And this is something that, really I think patients have a definition for, and surgeons, have a definition for, and they're really not the same. Patients come in to me a lot, and they're, to my, office, and we talk about tummy tucks. They say, well, I want a mini tummy tuck, because they think mini means shorter scar. And really, while most mini tummy tucks, the scar is a little bit shorter than a traditional tummy tuck, it's really not that much shorter. So patients think smaller scar, which may or may not be the case. And they sometimes think that maybe the belly button is not involved. And so I'll tell you, the plastic surgery definition of a mini tummy tuck is usually a smaller scar, so within the hip bones, and also it's fixing the muscle from the belly button down to the pubic bone. So it's not affecting the muscle on top of the belly button. And, that can be the right surgery in some patients, but it's a minority of patients. And I think when mini tummy tucks are usually performed, especially in my practice, it's a major reason for patients seeking out revisions. So when I see patients sometimes for revision tummy tucks, they've had a mini tummy tuck performed, and now they're tight from the belly button down, but they have bulging from above the belly button. And so, really a minority of patients are really a good candidate for a mini tummy tuck. If you have true diastasis, more often than not, your diastasis begins underneath the breastbone, so from the xiphoid all the way down to the pubic bone. And, within my years of practice, I've only performed a very few mini tummy tucks. So, these are things that we kind of talk about. We go over pictures in your consultation so that you can understand better. Okay, so another one is an extended tummy tuck, and really that just means that the incision is extended as far towards the back as possible or as needed. These are usually patients who have undergone weight loss, and it's not a full body lift where we go all the way to the back, but it's as far as we can without flipping you over and doing really a posterior body lift. And that's really just for people with excessive amounts of skin. The belly button is still recreated. The goal is still to create abdominal definition, and the plication of the muscle repair is a full plication repair. And then we have another one that's fleur-de-lis type tummy tuck. And so again, this is reserved, again for weight loss patients. And, when we have loose skin, whether it's from pregnancy or weight loss, the skin can be excised horizontally, like we do, where we keep the incision line very low, and it can be excised vertically to where we have the incision that goes up the midline of the abdomen. And so that is really reserved for extensive weight loss body contouring, where just tightening it with a low transverse scar is not going to be enough for the patient. And so these are patients that have over 100-pound weight loss, and those are things that we talk about, because with that becomes a scar that can't be hidden. So these patients have to understand that it comes with a considerable scar, and if you go in a bikini or without a shirt, the scar is always there. Now we work with you about scar management, and the scar tends to fade at a year, but there's always a scar. And I feel like it also makes the belly button look a little bit less natural, because there's a scar running up and down straight through the belly button. So these again are all things that we talk about during your consultation. So let's go back to this goal picture. So, this is whatever tummy tuck we decide to embark upon, this is what we're trying to create. We're trying to create a natural belly button. We're trying to create definition to the tummy, all with a scar that is hidden. So let's look through some results. So this patient, she underwent what we call a traditional tummy tuck. Now, traditional tummy tuck from surgeon to surgeon quite varies a lot, and so you have to really kind of look at your surgeon's before and after photos, and really kind of talk about what the goals of surgery are. When patients come see me for tummy tucks and body contouring, the goals are to create natural transitions from different body parts. So when we look at I want a natural transition from the abdomen to the waist, from the waist to the back, and from the waist to the buttocks. So most of my tummy tucks, what we talk about is we're going to do some type of liposuction to the upper abdomen. We're going to do liposuction to the waist. We're going to do liposuction to the back, and then plus or minus adding fat to the outer or lateral buttock that we call. And so the goals are low transverse incision, natural belly button, and to establish, abdominal definition. So, this patient right here underwent liposuction abdomen, her waist, her back, fat transfer to her outer buttock. And, you can see that she has a scar from hip to hip, but even with those fantastic picture underwear, you cannot see her scar. Her scar is hidden in that thin white string of the picture underwear. She has a natural belly button, and we've created and maintained the natural definition to her abdomen. You can even see kind of her curves that we've reestablished an hourglass figure. And so, those are the goals. Those are the goals for my patients that I'm trying to accomplish for them. Okay, let's look at another patient. So again, right here is another traditional type tummy tuck. So, she underwent liposuction to her abdomen, her waist, her back, fat transfer to her outer buttocks. We also did fat transfer to her breast. But you can see the same thing of the goals. The goals are to keep the scar hidden and keep the scar hidden in the bikini line or underwear. So the morning of surgery, I do, ask you to bring in some underwear or bikini that you like that's low. We mark it and we do our best to keep it within that line. And so the goal is always to keep the scar as low as possible. You can see that we've maintained a natural belly button for her, and we've maintained those lines and definition to her abdomen. So it's not, the goal is not just cutting away skin and just tightening it as tight as possible and losing some of that definition. We want to really kind of maintain the definition and really improve upon it. And I think we've accomplished that. And so, some patients like this would potentially come in and say, well, Dr. Walters, I only want a mini tummy tuck. And that would be the wrong operation for her. Yes, it may be a smaller scar, but then she's not going to be happy with the transition from the waist to the buttocks. And so, it's my job to kind of tell patients why sometimes larger scars are needed in order to produce a result like this patient has. Okay, so another example, mommy makeover. She underwent breast augmentation as well as fat transfer to her breast. But you can see she underwent, a traditional type tummy tuck. So, liposuction to the abdomen, the waist, the back, fat transfer to her outer buttocks to create that nice S curve. She has an incision that really runs hip to hip, but you can see that it's low, it's hidden, and we've maintained and even defined better the definition to her abdomen. So, it's not just a flat, unnatural appearing abdomen. And so again, if this patient came to me and said, well, I just want a quick recovery, I want, a mini tummy tuck, that would be the wrong operation for her, and that would set her up for potential revision at a later date. Okay, so let's talk about, another type of tummy tuck. So this is something that some people kind of call a mini tummy tuck, but it's really a variation of a traditional type tummy tuck. So yes, she has a shorter scar. Her scar is really from inside the hip bone to hip bone. But we did liposuction, to her abdomen, to her waist. She had a full muscle repair. So we fixed the muscle from the xiphoid all the way down to the pubic bone. But what we did was we didn't cut around the belly button. This is called a, modified or floating type tummy tuck. And so what that means is that we floated the belly button just a little bit. And so, meaning we lowered it from the inside. And you can see that she starts somewhat with a higher belly button. So, every belly button position, the starting point's a little bit different from patient to patient. And so with this patient, I was able to, not cut around the belly button, but still fix the muscle from, underneath her breastbone all the way down to the pubic bone to create that nice definition to her abdomen, and then only just lower the belly button some. Now you can see that our belly button still looks like it's in a good position. It's not too low, and we've created an attractive abdomen. The limits of this procedure is when the belly button is lowered too much, and I'll show you an example of that. So, really, to be a good candidate for this is you need to have, not that much of loose skin, and you have to really just have more diastasis than loose skin, and your belly button has to be in a higher position to begin with, so that when we lower it some, we lower it back into somewhat of a normal position. If you lower it too low and there's no scar around the belly button, it's going to look very weird. So let's look at, okay, so this patient came to see me for a revision, and on the left, she had what's called a floating tummy tuck. And you can see that her belly button is placed a little bit too low. She had improper muscle repair and really was not happy. She saw a physician who was an ear, nose, and throat doctor, who kind of hid behind the term cosmetic surgeon. So no properly, training in plastic surgery itself. So, she didn't realize that. She thought she did her homework. She thought he was a board certified plastic surgeon, but to find out he really wasn't. So what we had to do here was to really revise the entire tummy tuck, do liposuction to the abdomen, do liposuction to the waist, the back, add fat to her outer buttock to kind of create more of the hourglass type shape, keep a low scar, but then I really had to do what's called a neo-umbilicus. So we really had to reconstruct an entirely new belly button for her. And you can see in that picture that we've now created the belly button in a more youthful and athletic position. We can see another position right there. So you can see from the 3/4 view, from above the belly button, it was improperly repaired, the muscle separation. So, we had to go back and fully correct that, maintain, or create definition to her abdomen, create smooth transitions from the abdomen to the waist, to the buttocks, and to the back. And I think you can see that curve that we've created with fat transfer. And then again, reconstructed her belly button in the proper position. Okay, here's like a side view of another patient who, came to see me very fit, and you can see that you would almost be tempted, and I was almost tempted for her to do a mini tummy tuck to fix the muscle separation from the belly button down only, but that would have been the wrong operation for her. She needs, as you can see in the post-op on the right, she still needs that tightening above the belly button. So from below the breast, to the belly button, I repaired that muscle separation fully. So she had, even this patient underwent a full tummy tuck. And so, she is fit, works out, and, is in good shape. And so we can, yes, keep the scar a little bit shorter than someone with excess skin, but she still needed, due to her pregnancies, multiple pregnancies, she still needed that full muscle repair in order to get, a natural and beautiful result. And this was someone, some people say, well, if I diet and exercise enough, I won't need a tummy tuck. She was very active in the gym, worked out every single day, but still had that muscle separation. And so no matter, what, she was in great shape, but she couldn't really tighten her abdomen to her liking. Okay, so let's look at another revision and why, we say that not all tummy tucks are created equally. So this patient, went to another surgeon and, got a tummy tuck and ended up with this result. And so, you can see that the scar is high. She has kind of still some excess skin at the end of the incision near the waist. She still has liposuction that can be performed in the waist. She has not a smooth transition from the waist to the buttocks. Belly button is a little unnatural, and she really doesn't have that definition, to her abdomen. So the goals for her were to lower the incision, do some revision liposuction, add fat transfer to her buttocks, make her belly button more natural, and then again create that abdominal definition. So you can see in the picture on the right, I think those are all things that we have accomplished: lower scar, natural belly button, abdominal definition, and smooth transitions from the waist to the buttocks. And these are tough cases because you're operating through scar tissue, and it's really more difficult to get things right the second or third time than to get it right the first time. This is one patient. This is just you're not gonna be able to see it because I'm but anyway, this is a patient who's on table who, in the last year, I've really only performed one mini tummy tuck. She was an example, but we really can't see that. So again, mini tummy tucks are very few and far between. It's important to kind of, be properly diagnosed by your plastic surgeon. And just because something sounds too good to be true, most of the time it is. Oh. Okay, so let's answer some questions. Okay, so could you please discuss pregnancy after tummy tuck? So what I normally tell patients is, most patients after pregnancy, they would benefit from a tummy tuck if they're looking to have better abdominal definition. And the reasons for that is that three things really happen with pregnancy. The muscle gets separated, you get loose skin, and you have leftover fat or what we call lipodystrophy. So, with that, the only procedure that corrects those three things is a surgical tummy tuck. We do liposuction to correct the lipodystrophy. We do the tummy tuck to tighten the loose skin and to tighten the abdominal muscle. So what I tell patients, you have to wait at least 3 months, usually 3 to 6 months after having children before you embark on a tummy tuck. And the main reasons is we need to let the tissues contract and for your body to get back to as much normal as possible before we undergo surgery. Sometimes that's 3 months, sometimes it takes 6 months. I do tell patients too that they should be finished with childbearing, because if you do get pregnant after a tummy tuck, you're not putting the baby in danger or anything like that, but you really will potentially ruin the muscle repair. You will end up with potentially some loose skin, and so then you would need another tummy tuck more than likely to get the results that you obtained from the first tummy tuck. All right, so I hope that kind of explains most things. I think these are common questions that we answer daily in all of our in-office consultations that we were having before coronavirus, and now that we do with our virtual consultations. So the better that my potential patients are educated before they come see me, I think it just makes for a better consultation and a better experience all around. So that's why we stress education a lot on our social media channels. Okay, any more questions? Okay, well, what we'll do is we'll be here tomorrow morning educating about another tummy tuck. Here's another question. Let's see. Is post-op care the same for a tummy tuck revision? Yes, it's for my patients, it's pretty much the same. all of my tummy tucks are usually outpatient procedures. They can range from, 2 hours to 5 hours. It just depends on, what we're doing. And so usually, it's an outpatient procedure. I see you back usually at 48 hours. You have some type of compression garment. You usually have some type of drains. And then, that the night of surgery, you're, up and you're walking around. We send you home on disposable plexi pulse machines. So those are kind of little pumps in your legs to prevent DVT. And usually what I see you back at 48 hours just to check the incision, look at everything. I see you back at 1 week, take out some sutures, take out some drains. And then I usually see you back at the month mark. And so what I tell patients is it usually takes about 2 weeks for you to feel back to normal. So you need help usually for the first 2 weeks. And there's no heavy lifting for approximately 4 weeks. After about 4 weeks, most patients, are free to go back to, exercise and heavy lifting. Most people go back to work after about 2 weeks, still with some restrictions as far as, no heavy lifting. And, that's pretty much the same for whether I do a tummy tuck for the first time or if we do any type of revisions. It's pretty much the same. Okay, well, if you guys have any more questions, feel free, you can DM me. Again, if you want to set up a consultation, there's a form on our website that you can do. And again, just we'll be educating as long as we're in this quarantine. So if you have any topics you want me to cover, just feel free to reach out. I'll see everybody tomorrow. Y'all have a good day.